Okay. Dr. Carlson, we hear lots about ingrown toenails, and is there a way to, like, the way you cut your nails and take care of it, that one can, like, help out, prevent, and if one has one, why should one go and fix them more steadily with a podiatrist? Otherwise, all hell breaks loose. Tell us all about it.
Okay, ingrown nails. All right, ingrown nails come from a couple different reasons. It can come, number one, from a tight shoe, from the toe hitting on the tight shoe, causing the nail to ingrow. The second reason could be hereditary. Some people actually are born with these nails that look like claws, and they're called pincer nails. And the third thing could be from improper cutting. Most people tend to like to cut their toenails rounded or cut down the corners. That's a good way to get an ingrown. Really, the nail should be cut straight across and not cut down on the sides. That will prevent an ingrown, allowing the nail to grow out. The other thing, people tend to keep the nails very short. The nail should actually come to the end of the toe, and that should be the length that the nail should be kept at. If you cut it much shorter, again, that would promote an ingrown. And the reason why I guess
the meat wearing shoes, especially when you wear tight shoes, kind of like gets pushed up, and then the nail grows right into it. That's, I guess, all it is, right?
Yes, that's correct. That is correct. And a lot of time people also have bunions and hammer toes, and if the toe crosses over, it tends to press on the great toenail or the big toenail, and that pressure, again, is a mechanical pressure causing the nail to grow in. So some of the reasons why you should actually get the ingrown nail taken care of professionally is, what happens is if that nail is ingrown and it pierces through the skin, there's normal bacteria that lives on the skin. And when normal bacteria pierces through the skin and gets into the bloodstream, as you know, you get an infection. And that infection can, travel up to the foot, up the leg. Some cases, some people let it grow for a very long time, and it grows into the bone. So then they wind up getting a bone infection, and that is quite serious. So as soon as anybody really feels any kind of pain or sees any kind of redness, or especially any drainage, any pus or, red bloody drainage, they should get in right away and have it professionally attended to.
Well, that makes a lot of sense, because not for nothing they call an infection an infection, because by definition an infection infects other areas around them. And you don't want to have your blood slowly poisoned with that infection on a continuous basis, because it probably brings down, just like a gum disease would, or any other infection in the body, on the finger, wherever you get it, for whatever damn reason you get it. If there's an infection, all the soldiers which fight that infection in your body, the antioxidants, the whatever, they cannot fight the normal thing like immune system anymore. So I guess a little toe infection could make you fatigue, could make you more susceptible to do all kinds of other illnesses, like just the everyday flu. Yes? No?
Yeah, it definitely wears down on your immune system. And, a lot of times, you get that little infection, it can travel up the leg. And some people, for whatever reason, if they're immunocompromised or sick, people who are going through cancer treatments, or diabetics, or people on immunosuppressive drugs with other diseases, their system really can't fight as well as a normal healthy person, so it can tend to get out of hand, and sometimes people let it go, and they wind up needing to go in with, what we call an infection of the leg is the cellulitis, and wind up have to go into the hospital for IV antibiotics. So the bottom line is, if you catch it early, and if you are one of these people that have these problems, get in, get in and see somebody and just get it taken care of, instead of making it something much bigger than it really needs to be.
Right. It's like with everything else. Just try to fix it early and confront it. Don't delay it. Just go and do what needs to be done. And,
right.
And it prevents problems. All right. Good. I guess that should be informative to find out what to do with those toenails. Okay. Well, what about, like you said, growing them a little longer? What about the bill of socks? I mean, my wife keeps telling me, hey, cut your toenails. I keep finding holes in your socks again. That must come from your toenails. I mean, what about that? I mean, who's talking about the economics of this whole thing?
Well, the nails should actually just be grown to the edge of the toe, all right? Not anything where it hangs over longer. If it hangs over longer, then of course you're going to put the hole in your sock, but just to the edge. Because if it's cut too short, you wind up getting problems.
So I guess I'm definitely not too short, but I might be too long. I think
it might be a little long, exactly.
I think they have a word for that called slappy or something like that, right?
Maybe.
Okay, I'm not so sure I like that you're on my wife's side, but then again, she's definitely the star in my life, so I guess it's okay. I'll let her know that you are right.
Okay.
Bye-bye.